At the time being 6 o'clock, I'm going to call the Board of Health meeting to order. All members are present. Would everyone please stand and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. At this time, I will call on our health agent, Chris Schultz, to give us some announcements from the health department.
Sure. I'll keep it brief. I just want to remind folks that the threat level for both EEE and West Nile virus for Abington are at the moderate level. There still have been no human cases in Abington or the surrounding towns, but there have been human cases in the state. And the office will be closed this Wednesday to Friday, as I will be out of town at a annual conference. So just in case anybody needs the health department, I'm available by phone, but the office will be closed Wednesday, Thursday, Friday. And that's all I have for announcements.
It was this week.
Mm-hmm.
Any questions for Chris? Seeing none, we'll move on to our discussion and action items. First item on our discussion action item portion are approval of the previous meeting's minutes. Everyone should have a copy of the minutes from August 18th. Do I have any action on those?
I'll make a motion to approve the minutes.
Motion to approve by Katie. Is there a second?
I'll second.
Second by Carol. Any further discussion? All in favor?
Aye.
Aye. Opposed? It is unanimous. Those are approved. The next item is a discussion and approval of the intermunicipal agreement for the Public Health Excellence for Shared Services Grant. This is something that the selectmen just discussed across the hall. So Chris, can I have you give a little background on this?
Sure. In case anyone's not familiar, Abington entered into a shared services agreement with the towns of Whitman, Avon, Stoughton, and City of Brockton. I think it was 3 years, two or 3 years ago. This is part of the state's effort as DPH looked at the state of Massachusetts, or the Commonwealth of Massachusetts. There are a different board of health in every town and city, and they are all at different levels of capacity and doing different things. And the state has wanted to standardize that. So as part of that, they have a rather large grant. It's a $3 million grant broken over several years. Abington was the lead agency when we started, and we've been working with those towns for the last few years. And so far it's been great. It's made us available to do a lot of training, to upgrade all of our equipment, make new purchases, all good stuff. So the IMA that they're looking at right now, we're just switching the lead agency from Abington to Brockton. Abington originally had hired a shared services coordinator to do all the work for the grant. She was not doing that, didn't work out so well. She was let go. We kind of struggled with it since then. Brockton has the capacity to run it and was willing to do it. The other towns were all on board and have signed off. So this is just getting Abington signed off, and then the grant will continue as is. So that's.
We were involved with different towns. Brockton wasn't a part of it before.
Mm-hmm.
Yeah, but that's a big gun to bring.
Yeah. And they are definitely better suited to be managing the grant because they have the staffing over there. So.
Yeah, and resources.
Yep.
So in terms of this agreement in particular, Abington, I believe, is the last community that needs to actually approve this. All of the others have. Yep. So at this point, the selectmen, the town manager, those are the ones that procure any contracts and things of that nature. So our approval is more just this than a actual, big approval. But we really should still do that. So unless there are any other questions, I would entertain a motion on this.
I'll make a motion to approve the intermunicipal agreement.
Okay.
Excellence.
I have a motion to approve the IMA for the Public Health Excellence Shared Service Grant. Do I have a second?
I second that.
Second from Carol. Any further discussion? All in favor? Aye.
I'll do the next one. Aye.
Aye.
Okay.
Sorry.
I was getting worried there. Opposed? And it's unanimous, so we've approved that. We'll get that signed and taken care of.
You feel good about it, Chris? You feel good about it?
Oh yeah, no, it's an excellent grant. If we didn't get the sign and we got kicked out of it, we would be the only community in the entire state not in a shared
Oh,
services
yeah, yeah.
grant. So,
Yeah.
yay, thank you
Oh,
very
so
much.
they partitioned the whole state.
Yep. Yeah, they're all in groups about 5.
Well, pairing up with A1 is really good because they have a lot of resources and only like 5,000 people. So,
Yeah.
so that's like, so if you guys need my, there you go. And that's my child lives in A1 too. So I like that we're all on the same theme of things because if resources need to be doled out,
Yeah, and one of the things we're looking at doing, we're once the IMA is all settled, is hiring a community resource specialist for the towns. So that way, like when we run into a hoarding situation, we have somebody who can find resources for those people and
That's nice.
different things that we're doing rather than struggling with the staffing that we have to find stuff. We have someone dedicated to servicing the towns and shared inspectors to help with workload. So all good, all good stuff.
Congratulations.
Moving forward, just a discussion regarding filling a recent board vacancy. So as you see, we have an empty chair. Jason Harris resigned at the end of August due to relocation. So with that, there is a process to fill a vacancy in office. As of today, you may have seen it on the way in. There is a posting. There are 2 attachments in your packet. One is section 7-11 of, I believe it's the town charter. Yep, it is. And talks about the notice of vacancy. So what we did in between the last meeting and now, sent a letter notifying the selectmen that there was a vacancy in office due to basically abandonment of office is how that's whatever worded. So with the vacancy, the Board of Selectmen will fill a vacancy. They can't fill a vacancy earlier than 14 days after they post it and no later than 30. They have 10 days from the notice going out for people to return their interest online. Once that's done, they'll compile that and then be able to vote on that at a meeting. So at some point over the next month, we will have a joint meeting with the Board of Selectmen. What day that is, when, don't know until they set it. When that happens, we will let you know. It'll be posted like a normal meeting, and we'll just have, it'll be at some random time on a random Monday, probably at a 5:30, 6 o'clock time period, to fill that
Look at the
vacancy.
candidates,
Yeah. So I will try to make sure that we get copies of all of the applicants before. That has not happened in the past in some cases. Some cases it has. Depends on the mood we're in, I guess.
I was reading they have to come and present themselves as well, the
I
applicants.
don't know that they necessarily have to speak, but they are invited to. Trying to think of anything else there. That's basically how that's going to work. In the past too, I mean, if we get nobody, we may continue to operate as 4. It'll just be awkward, but we will do it. We don't often get a lot of tiebreakers here, which is good. But if we did, that's when we'll run into some challenges. We'll deal with those as they come. We've operated with as small as 3 before. That was exciting. So we did that for like 3 months. So we'll do what we need to. Any questions about that? Concerns? No?
What if there's no applicants?
We will be a 4-person board, and either the selectmen can choose to re-post the vacancy. And we've done it in the past where they posted it twice and they got nobody twice, so they just let us run vacant until they posted it for the next election.
Right.
So whatever the selectmen would like to do. So this would be the time if anybody's interested in running for the Board of Health. You know anybody that's interested in being on the Board of Health.
And they
let
don't
them know.
need to get signatures like they would for the election.
I don't believe so, no. They just go online, fill out the interest, and then, but if they want to complete the term at the next election, they'll need to run for election, for a full term.
Making sure, see the difference. So it's just a basically interim seat.
Yes, yeah, it's for a 1-year period, and actually, I believe it's to complete Jason's term, so it'll only be 1 more year, I think. Yep, however long you have left, that's how long.
right. And I've been on the other end of it.
Yeah.
You just fill out the application and then they bring you into a
Yeah.
meeting and then you talk about what you want to do.
But the sum of the 4-person, us, and the selectmen, so actually, they're a 4-person too, so depending upon if they filled it by then or not, right, which they won't, it'll be 8 people will get to decide who gets to be on the Board of Health, including us. Precedent has hopefully set that we get to make the first motion on that. Don't know if that's happened, but that was a change that came about because of the Board of Health, so
I like
hopefully
that.
that does.
I think it would be nice to thank Jason though for his time.
Yeah.
Well, of course,
Yeah,
of course
I
it
mean,
would be.
you know, I know he's not here and all, but he really did contribute a lot and I thought it was worth saying.
Right.
He
So,
was good.
Definitely, that chair is a lot more empty without him in it. Anyways, moving forward, health department update and health agent report. I'll let you do those together.
Okay, so for staffing update, I'm going to read the email that went out from our town manager, writing to share that Lindsay Wright, our public health nurse and director of emergency management, has resigned to pursue new opportunities. Lindsay has been an invaluable member of our team, steady, thoughtful, and always ready to help. Her work strengthened our public health programs, and her partnership across departments made us better. She will be missed, and we're grateful for all she's done for Abington. So that was effective this past Friday. So I am the health department at the moment.
And that explains the other agreement.
Yeah.
Because she was a emergency management person. I was gonna ask why we weren't talking to Lindsay about that, but okay.
Yep. So in the immediate aftermath of that, at least at this time, there will be no flu clinics. I've been getting calls from people looking for flu shots and COVID boosters. A recommendation would be Duval's has got all the different vaccines, any of your local pharmacies. Once the IMA is signed and set, I will talk to Brockton and other things because I have flu vaccines.
Yeah,
You don't want me giving them to you?
Can you ever reach out to like the visiting nurses, the social visiting nurses who've done that before
Yep.
for us in the past?
Yeah, and I have a
pitch for different things like that.
yeah, and I have a couple of nurses that have volunteered to set something up. So it's just a couple of hurdles to clear to do that, but that's
Sure.
some of the stuff that we're looking
Sure,
at. So.
certainly something to navigate.
Yep. So that's one of the reasons why we'll be closed for the rest of the week too while I'm at the
Yeah.
MEHA conference because at this moment I am the only staff person in the health department. Lindsay has already been missed. So that's our department update. As for the health agent report, I get a list of inspections. Just keeping up with our regulars. No new businesses this last period. No priority violations. And just so people are clear too, when it says no priority violations, that a priority violation is something that we fine for. It's something that's an immediate threat to health. Food being kept below temperature or above temperature, unsanitary handling practices. That doesn't mean that these are all perfect inspections. A lot of these businesses had minor violations, expired products on the shelf, things like that, but that's not a priority violation, and those are the ones I list. That is safe. Most of our businesses are very good. Complaints that we received, 819, leaking ceiling at the point. That was resolved. Also on the 19th, a pure tone from cell tower on Route 18. If anybody's not familiar with a pure tone, that's a beep, like loud piercing noise. It was coming from the cell tower. Lindsay was able to get a hold of the company that owned the tower and get the tone shut off. Something emanating from the building there. Rat sighting on Pine Street and on Myers Ave. We did the same practice as we've done in the past. Notification went out to everybody in the neighborhood with instructions and advice on how to keep your yard rat-free and what to look for. 821, I got a call from somebody saying that Walmart was reusing plastic bags. In the past, when they've run out of the reusable plastic bags, the heavy-duty ones, they've gone back to single use. I have told them that's not acceptable. Same with Target. They've been fined for that. So apparently they ran out and they were reusing the heavy bags that people had brought in for recycling. When I got there, they had bags on the registers. None of that was going on. So I didn't personally see anything. Then this morning I got a complaint for a mold complaint over at 102 Walnut Street. I was able to resolve that situation with the landlord. Thankfully, we didn't have to write orders. And then trainings or conferences attended by a health agent. Just letting you guys know that I will be at the Mass Environmental Health Agency Association's annual conference from Wednesday through Friday. So the office will be closed. That's it for me.
All right, any questions for Chris on the health agent report? Any correspondence from the health department or the board?
No.
Okay. With that, that's the end of our agenda. I'd entertain a motion to adjourn.
I'll make a motion to adjourn.
Motion to adjourn from Katie,
I will second that.
second from Carol. All those in favor, please signify by saying aye.
Aye.
Aye, opposed, it's unanimous, we're adjourned.